Hello, everyone. Very pleased and honored to be a part of this excellent symposium, and I'm so thankful to the organizers and especially Dr. Becky Inkster for having me here. This is Munmun Choudhury. I am an associate professor of interactive computing at Georgia Tech. My video is going to highlight some of our work using social media and computational techniques to influence innovations in the digital mental health space. So, let me begin by telling you a little bit about myself. So, I'm trained as a computer scientist, but I'm very passionate about problems at the intersection of computer science and social science. My research program of over a decade now has built a variety of different computational and machine learning approaches, harnessing large scale online data alongside advances in machine learning and grounding in human centered approaches to answer many fundamental questions that are related to our social lives and human behaviors. Since 2013, I have led an innovative research agenda that has situated social media as both a mechanism to understand our mental health as well as to improve access to mental health care. So, let me give you a little bit of background here. So, powered by the data and digital traces that are left behind by millions of individuals on different online and social media platforms, over the past decade and a half, computer scientists and other social scientists together have made a lot of significant strides into improving our understanding of a variety of different social phenomena. These data have now provided new ways for us to measure our social interactions, our moods and emotions, and our collective action. Computational researchers like myself have also made significant contributions to improving our understanding of a variety of different real world events and outcomes, crisis, health and well being, civic engagement by harnessing different digital data. So, in this context, my research has pioneered the computational use of social media data for mental health in an ethical and responsible manner. This was first shown in one of our papers from 2013, where we were able to identify risk markers of major depression in individuals up to an year before their clinical diagnosis by developing predictive models on their Twitter data. In the next few slides, I'll give you some glimpses and details of this research using a multi scale approach. All right. So, in one of our early works, we focused on the individual, and in this space, what we sought out to do was to test the feasibility that social media data may provide in gleaning meaningful insights about our psychological state and our forthcoming risk. So, for instance, in this work, we looked at new mothers who use social media platforms such as Twitter and Facebook, and we try to understand what kind of behavioral and effective indicators can we get by looking at people's social media activities, and how that information could relate to risk of postpartum changes and depression in these new moms. What we found in this work is that by looking at social media data spanning several months, we can get many meaningful insights about people's social interactions, their levels of activity on these platforms, the nature of emotions that they express on these platforms, as well as their interpersonal focus and temporal orientation. And in fact, what we found in this work is that by looking at Twitter and Facebook data, we can not only identify that about 15 to 20 5% of new moms who use these platforms do show some indicators of significant postpartum changes in their mood and behavior. But in fact, we can use these insights in a predictive modeling framework that would tell us the risk of postpartum depression several months ahead of time. All right, so let's talk about communities now. So, communities are a slightly different granularity compared to the individual, but still, the data that communities leave behind on social media platforms can still have a lot of value in helping us understand the experiences that different community members may have at different points in time, and subject to different types of incidents that these communities might experience because of their situated nature. So in this work, we looked at college communities, and we looked at gun violence incidents as a type of negative set of incidents and crises that are experienced by college community members at different points in time. And we wanted to see how we can look at social media activities of college communities and what it can tell us about the psychological distress that these communities face over time. So, looking at 12 incidents of gun violence over 12 universities over a period of 5 years, what we found in this work is that there are many meaningful signals about the community as a whole that we can get by looking at the language that is shared in different conversations of the members of these communities. In particular, what we noticed in this work is that we can build supervised machine learning models that can assess the levels of stress that are expressed in the conversations in these college subreddits. And this level of stress increases in the periods after these gun violence incidents relative to the levels of stress that we see in the period before. In fact, the changes that we see seem to be quite stark and different compared to the levels of chronic stress that we might expect to be prevalent in a college population at a time period when there are no such crises. All right, so finally, let's talk about the population level granularity. In this work from a few years ago, we had developed an index to measure depression over a certain geographic area in a near real time fashion. The idea here was to leverage a supervised machine learning classifier that we had built in some of our prior work that would assess levels of depression based on the postings that are made on a Twitter timeline or another social media platform feed. We had validated that supervised machine learning algorithm against standardized screening tools of depression, and we found promising concurrence and convergent validity of our method. So this is what we can do with this depression index that functions at the granularity of a large population. If you notice the two pictures on this slide, on the right we have the levels of depression that are assessed based on our social media depression index, and on the left you have the actual rates of depression that are noted in the data of the Behavioral Risk Factor Surveillance Survey, which is a survey that is run by the CDC every few years to assess different mental health conditions. What we find by comparing these pictures in the slide, both visually and statistically, is that there is a strong convergent validity that we can assess from our social media based depression index. And this kind of a measure can not only help us augment the kinds of survey assessments of depression that we can make, but it also can provide us insights in a near real time fashion, telling us about seasonal trends of depression, about diurnal trends of depression, as well as how depression experiences vary depending upon the sociodemographics of different subpopulations. Okay, so now that you have heard about these three different research problems and their solutions that can be provided by looking at social media data, you might be wondering, so what is the next step in this line of work? Are we ready for real world deployment or use of these models? And what would be the best way to do that? So, I believe that the most promising potential use of these insights would be to connect people in need and those who are in distress with timely and proactive help. And this could be in the form of technological interventions or other kinds of platforms, tools, interfaces, and apps that could be built that are powered by the insights given by these data and by these algorithms. There's also a lot of potential for community organizers and other stakeholders, as well as public health organizations, to harness these kinds of algorithmic insights to influence policy that they might be framing, their budgetary decisions, as well as their decision making going forward. So now the question is, so what is preventing us from pursuing these directions, right? All right. I would note three issues that we need to pay attention to and address before we can realize the potential of these social media data and the algorithmic insights that they can provide to support digital mental health. These are agency and power, unintended negative consequences, and ethics. Broadly speaking, there are many remaining issues and questions that we need to address beyond the technical innovations that social media data and similar data provide to influence mental health outcomes. For instance, how do we consent people? What provisions should we have to prevent adverse outcomes? How do we protect a vulnerable population who is subject to this research? And then, what is the social and moral responsibility of the researchers in minimizing harms? Ultimately, what these questions point to is the need for consideration of these three things: agency and power, unintended negative consequences, and ethics as a part of the research process itself instead of as an afterthought. In the remainder of this video, I will present a collaborative participatory approach to make our research not just rigorous and ethical, but also practical and actionable. One of the two projects that I'll talk about here is called Thrive. Thrive is a collaboration with a large healthcare system in New York with a very reputed psychiatric hospital and research center. This system is known as the Northwell Health System. Our broader goal within the Thrive project here is to examine how meaningful signals can be derived from voluntarily shared social media data of patients with serious mental illnesses such as schizophrenia and bipolar disorder, which can support clinical decision making and tailoring treatment plans while also giving the patient a voice in participating in their own treatment process. Within this project, some of our recent research has focused on the following very important question: whether we can predict relapse in patients with psychotic disorders by computational modeling of their social media data. As you may know, relapses are very common. Even for patients undergoing treatment, up to 80% relapse in the course of their first 5 years of treatment. We developed an anomaly detection framework in order to answer this question on relapse prediction, and this model revealed that relapses can be detected in a personalized fashion in a patient's Facebook data up to a month before the patient is hospitalized due to the relapse, and that these relapse indicators show up as aberrations in various ways, such as in their Facebook activity, in the language they use, and the socializations that they have on the platform. So, our main finding here was that such predictive models been built on social media data and the outcomes that they provide computationally can actually be quite helpful in providing meaningful and actionable collateral information to clinicians, which can be adjuvant or complementary to their conventional assessments of mental illness. Next, in the same vein, I would like to highlight a second project in this video called Reduce Suicide. This work is based on what is now an 18-month collaboration with the US Centers for Disease Control and Prevention, and our central goal here has been to inform suicide prevention efforts using social media in conjunction with other kinds of public health signals. So you may be aware that the rates of suicide in the US has been increasing over the last 20 years. In spite of the urgency of this public health problem, currently we don't have a good knowledge of real-time information on suicide fatality trends that could guide prevention efforts. The US National Vital Statistics System, it collects a variety of information, pretty accurate, based on death certificates that are submitted by more than 2,000 medical examiners and coroner offices throughout the country. But these statistics on suicide rates are delayed by 1 to 2 years, And this causes serious challenges for governmental agencies to make budgetary decisions, deploy interventions, and adapt policies for improving timely access to care or design programs for suicide prevention. So, to address this gap, in this collaborative work, what we have been doing is to develop a first of its kind machine learning model to estimate weekly suicide fatalities in the country in near real time. An approach that currently doesn't exist but can have a lot of impact in improving our understanding of trends in suicide. Specifically, in this work, we developed and validated a two-phase machine learning pipeline that uses recent advances such as deep neural networks to leverage a variety of different disparate but complementary streams of real-time data related to suicide. So these include novel health services administrative data such as emergency room visits due to suicide or calls placed on the National Suicide Prevention Hotline, economic data, meteorological data, and online data such as social media and search engine use. Impressively, what we found is that this model is able to provide estimates of annual suicide rates that are less than 1% error with respect to the actual rates of suicide nationally, showcasing that suicide can be examined from the perspective of multiple data sources, each representing a unique aspect of the problem, and this can help inform federal support of appropriate programs and policies to prevent suicide that actually match the magnitude of the problem we are facing. So, finally, as someone who has worked in the digital mental health space for 8 years now, I want to leave you with two thoughts. First, we can do better than being extractive in our research approach. Most of the problems in digital mental health are not just clinical or public health problems that we are attempting to solve with a technical approach, but in doing so, we are actually tackling socio-technical problems, especially given how intertwined digital technologies are in people's lives today. Second, we should aspire to be not just good researchers, but also responsible researchers. Most of the problems in this emerging area are not inconsequential problems that constitute an academic research program, but instead are ones that can have a deep impact on people and society. As a highly multidisciplinary set of researchers, we therefore need to be the very change agents we can inspire the change and we would like to see in the world. As the renowned social psychologist Kurt Lewin said, if you truly want to understand something, change it. In this talk, I told you two stories about how we can use social media data in collaboration with important stakeholders to impact mental health outcomes. But beyond these problems and the specific issues I discussed, I would draw attention to a broader opportunity and call to action here, where scientists like ourselves can adopt a participatory, collaborative, multi stakeholder faceted research approach in digital mental health, broadly speaking. This includes, as we do our research, paying attention to building trust in affected communities, supporting graceful failures where our data or models cannot stand up to potential use cases, or importantly, doing no harm as the Hippocratic Oath goes. The question is, what is a path forward and an approach where these questions are not just afterthoughts, but are issues that we consider in our very methodologies themselves? And with that, I would like to conclude, acknowledging all my collaborators across the world and students, and last but not the least, the sponsors of this research. Thank you very much for listening today, and I'd be happy to take any questions you may have via email or other electronic means.